Hi everyone, my name is Shanita Buchanan and I am doing the Health Education Intervention Project with Professor Fidelo at Cal State San Marcos. The four health topics that I chose to review were stroke, obesity, hypertension, and nutrition, and the way that they correlate. So the windshield survey that I performed was done in Compton. The population in 2019 was 96,803 people. The median income is about $52,000 per year, which means that about 19,000 or almost 20,000 people live in poverty, and that is 20.5%. The demographic is predominantly Hispanic, 28% Black, a small portion of white, and 2.4% is considered other, which would probably cover Pacific Islanders like Samoans, Tongans, and Asians. The risk factors for stroke are hypertension, diabetes, high blood pressure, high cholesterol, smoking, obesity, unhealthy diet, and physical inactivity. It's said that 1 in 3 people die in the United States from cardiovascular disease and stroke, and that is nearly 900,000 people a year, essentially. The healthcare system spends about $214 billion in covering these issues. Obesity itself, U.S. obesity prevalence was 42% in 2018, and the annual healthcare cost in the United States was $147 billion. As far as demographics are concerned, which would apply to the Compton area, almost 50% of Black people are considered obese, 45% of Hispanics, 42% of whites, and 17% of Asians. 40% of people that are adults aged 20 to 39 are obese, and it kind of increases as you go along. So 40 to 59 age range is 44% obese, and those that are 60 and older are about 42% obese. And 14.4 million children are considered obese in the United States. Hypertension risk factors are consumption of unhealthy foods high in salts, fats, low in fruit and vegetables, diabetes, obesity, physical activity, excessive alcohol use, smoking, and genetics. 108 million adults in the United States have high blood pressure. The annual healthcare cost is about $48 billion. As far as men are concerned, 47% of men have hypertension, and 43% of women have hypertension. And demographically speaking, 54% of Black people have hypertension, 46% white, 39% Asian, and 36% Hispanic. As far as nutrition is concerned, eating a healthy diet lowers the risk of obesity, heart disease, stroke, and diabetes. In the United States, 19% of people aged 2 to 19 were considered obese, and 40% of adults are considered obese. 9 in 10 Americans consume too much sodium, and the recommendation for sodium consumption per day is less than 2,000 milligrams. But on average, in the American diet, 3,400 milligrams of sodium is consumed per day. 70% of sodium is consumed in the United States from packaged, processed, and store-bought food and restaurants. Healthy People 2020 essentially had the same goals for stroke and hypertension, which was to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke, early identification and treatment of heart attacks and strokes, prevention of repeat cardiovascular events, and reduction in deaths from cardiovascular disease. Same with obesity and nutrition. Healthy People 2020 had a common goal for these two, and that was to promote health and reduce chronic disease through the consumption of healthful diets and achievement and maintenance of healthy body weights. After looking through the objectives for the Healthy People 2020 for stroke, hypertension, obesity, and nutrition, they are as follows. Stroke objective is to reduce stroke deaths, reduce the proportion of adults with high total blood cholesterol levels, increase the proportion of adults who have had their blood cholesterol checked within the preceding 2 years and can state whether or not their blood pressure was normal or high. As far as hypertension is concerned, the objective is to reduce the proportion of adults with hypertension, reduce the proportion of children and adolescents with hypertension, increase the proportion of adults with hypertension who meet the recommended guidelines for sodium intake. For obesity, the objective is to increase the proportion of adults who are at a healthy weight and to reduce the proportion of adults who are obese. For nutrition, the objective is to reduce the consumption of calories from solid fats and reduce the consumption of calories from solid fats and added sugars. By conducting the windshield survey in Compton, I was able to assess that the demographic and the population were severely affected by the 4 health issues. So the abundance of fast food restaurants and liquor stores in the area, and the amount and severity of obesity in the community, and that was just based off of observation. The interviews that I conducted were with a registered nurse who lives in Compton, and also with a person who owned a recuperative care center in Compton. So the theoretical framework that was applied to this scenario is the precede proceed model. So for phase 1, the risk of obesity, hypertension, and heart disease and stroke are increased in the Compton community related to the increased access to non-nutritious foods. Phase 2 is understanding the socio-cultural economical influence on health being essential to understanding the health habits and needs of the Compton community. Phase 3, many of these health issues are preventable and require education and knowledge about the prevention of chronic illness, such as these 3, which are closely tied to the nutrition needs. Phase 4 is to implement education about the effects of nutrition on health, as previously stated. Phase 5, create colorful flyers with topics correlating obesity, hypertension, stroke, and heart disease with nutrition, and present simple pictures, statistics, and suggestions on food consumption. Phase 6, information should be displayed and presented concisely with a moment for question and answer, and then to also perform a teach back with those that are involved in the teaching series. Phase 7, the short-term impact is greater knowledge and sense of support geared towards a healthier lifestyle. Individuals will be able to identify modifiable health habits, and long-term effects are essentially to be determined because the time frame would only allot for a short-term identification. Phase 8, the effects of the educational series is desirable, knowledge is power, and health is wealth. Barriers are access to unhealthy food options, which is abundant. As stated before, the amount of fast food restaurants and liquor stores that is in the area was highly recognizable. Nutritious foods may be more costly than cheap processed foods, which may affect someone who is living in poverty, as the third slide stated. Cultural view on food is a challenge, and the general disinterest versus lack of time. Assets would include curiosity about how nutritious foods affect health, and how non-nutritious foods have long-term effects and can produce chronic illness. inquiries about the changes that can be implemented to improve health outcomes. And in a climate of self-awareness and health promotion, some people were seriously interested in making change and getting information that they needed to improve their quality of life. What is needed to behave differently is basic language and competency, which is necessary to understand the information provided, education about health promotion and recognizing the impact of environmental factors and how that affects health choices. Applying the newly acquired health knowledge is fundamental, and nursing and community services that promote health education should be advertised and occur regularly to build rapport and have a positive impact on the community. As far as the interventions are concerned, there is a list that is mostly directed to consumption of nutritious versus non-nutritious foods. So the main things are to eat a healthy diet, which lowers the risk of obesity, heart disease, and stroke, and hypertension. Eat a diet consisting of vegetables, fruits, whole grains, lean meats, and low fat dairy products. Eat less salt, less saturated fat, less sugar, and avoid eating processed and prepackaged foods which are high in sodium content. Substitute water for sugary drinks, so decreasing the amount of empty calorie intake, especially through sugar. Drink alcohol in moderation. Stop smoking. Monitor blood pressure at home. And those are summarized according to Healthy People 2020. So twice I presented the information at the local library covering the 4 health topics that are related to preventable chronic diseases. The goal was to encourage healthy lifestyle habits and reduce health disparities in the community. I created a colorful handout and presented the information, and I asked open-ended questions to encourage engagement and close the presentation with a question and answer. Successful teachback of the material determined that the information was well received. The short-term goal and result was determined by a survey that I presented to the attendees after the health presentation, and it presented with good reviews. However, one member did suggest that a Spanish translation of the handout be provided next time. The long-term result is to be determined. The cost of the handout was minimal, as I was able to print the handouts from home with a quality printer. Luckily, I had it on hand. Volunteer educators and free educational spaces would be an easy accommodation for the community to bear financially because it is essentially free. If paid based on salary, this could cost approximately $60 per hour, plus the cost of handouts, which could amount to 10 cents per sheet if that was a recurrent educational series. And essentially, no training is required for those presenting the information. Regarding the results and conclusions of the presentations, I felt that I was overall able to successfully encourage the individuals in attendance to implement healthy lifestyle changes and cease unhealthy habits. I felt like I was making a positive contribution to such an underserved community in Compton. Challenges I faced were obtaining times and places, or a place to conduct the health presentation. Also, attracting people to attend the presentation presented a significant amount of difficulty. Recommendations for future projects and educational series such as these would include increasing the amount of participants, both the presenters and the attendees, providing healthy snacks and water, which could potentially intrigue someone to attend the educational series, and create interactive health games, which might get people to feel more lighthearted, and learning. And these are the references that I used to complete my educational research and applied